So there's no sound?
Oh, I think
Is
there's
it
sound.
okay? Is there sound?
Give me just a second.
Okay. This is what we have going on here. It's IT issues. But if it was me doing it, we would never even have a podcast. So Sammy's really brilliant. It's the machine, Sam. It's the machine.
There's no sound. Oh, well, you have sound, but it's
Okay. Is it on? This is why going live. This is what happens, right? And the reason
okay.
why is it on?
You are back on.
Okay,
There's a little bit of a
yay!
hiccup.
All right. Thank you. Hopefully you didn't click off. I probably would have clicked off with that right there. I would have said, forget it, I'm out of here. Okay. Registered Dietitian Myrna Haag. I'm not even sure you got that. Welcome back. What I want to talk about in this video, which I think is super important, is understanding what additional information you should be asking your doctor for. The diet can make a difference. In other words, if you can get this information, you can follow a diet that can change the outcome. So, the number one killers in our country right now, cardiovascular disease, diabetes, these are the top ones. And when I'm dealing with patients and I'm getting their lipid panel, I don't always have enough information to really understand how much risk they have. And there's certain genetic markers that can really drive it home on what kind of diet they need and how much risk they really have. So I have patients come, they have a perfect lipid panel, and yet they're having heart attacks, they have other issues, and they can't understand it. So let's dive into the PowerPoint, and we'll get right into it. On this video, we're going to talk about, are we good, Sam?
Yeah. So, just give me just one
Okay.
second.
Okay.
Because if we're going to...
She's really awesome, by the way. Just this.
They can't hear you.
Oh,
Stop, don't click.
okay. All right.
Okay, no, you're good.
Okay, good. So are we on the PowerPoint?
Yeah, you should
Okay.
be good.
Perfect. So the top genes that I've been talking about is some of the top ones that we already went over was the APOE, that's the Alzheimer gene, the lipo(a). You can find all these on my YouTube channel. And what we're going to talk about in this video is the LDL. Those are the bad cholesterols. And when you typically get your panel from your doctor, you get your cholesterol, your triglycerides, your HDL, your LDL. What we're going to dive into is all about this LDL because that's not enough information to really understand if you're at risk or not. So when we're looking at this gene, because the LDL has a certain gene to it, do you have big LDL particles or do you have smaller ones? And this is all based on what your genes are. And epigenetics means that we can change the messaging of our genes, how they respond in our body based on our diet. A mutation is a little different. That means that the gene went haywire and it's not working. But epigenetics means that our gene is fine, but maybe our diet is affecting how that gene is being expressed. And this is certainly the case when it comes to the LDL cholesterol. So when we think about LDL cholesterol, it's understanding that when you're getting that LDL-C, that just means the concentration of the bad cholesterol. It doesn't dive deeper into what the concentration is made up of. So when you're looking at the concentration, what you really want to know is the size and also the number of particles. So the standard lipid cholesterol lab panel only measures the concentration of LDL and not the particle size and number, which may not indicate the true risk for your elevated LDL, because the greater the particle numbers, the more sticky they are in the artery wall. This increases the plaque in the artery. The clinical findings reflect that LDL-C, which is the standard test you're getting from your doctor, is not enough information to assess your risk for heart disease. In fact, you can have a normal cholesterol and be at higher risk because you have a genetic for small little LDLs, not the big, large, fluffy ones. So the epigenetics means how is your diet affecting the expression of this gene? In other words, maybe you have the small, little cholesterols, the LDLs. So we want to know exactly, what does that mean for me? How am I at greater risk? Well, small, dense LDLs, like I said, your lipid panel can have a concentration. You're looking at it. Maybe it's normal. Maybe your LDLs are lower than 100. You think you're out of the danger zone, when in fact, they may not be getting enough information, and the size really matters. So when the LDLs are smaller, you're going to have an increase of oxidation in the artery wall. And we'll talk about what that means. You're going to have these fats stay longer in the bloodstream. They're going to be the most atherogenic, which means they're going to create the most plaque, along with the lipo(a). That's another bad cholesterol I talked about in one of my YouTube videos. And it's also going to increase insulin resistance, which I'm going to touch on in this video, but I have a video explicitly that talks about that in detail. So bottom line, if your LDLs tend to be smaller in size, you're going to be at greater risk for having oxidation, for having them staying longer in the bloodstream, which is going to increase your risk for insulin resistance, which is type 2 diabetes. They're going to be the highest level of the ones that create the plaque. And also, it's associated with elevated triglycerides. A lot of times you get your blood done and you're looking at the triglycerides, and maybe they're always high. Well, typically when we see higher triglycerides, we're usually looking at somebody that has smaller LDLs. So let's go. And what's the amount we want? Well, we want to try to keep it under 40 mg. So this kind of gives us a value. Of course, once you get the test done, your doctor's going to give you that range, because that's part of the values you get when you get your blood work done. So let's go click on and figure out what we're talking about when we're looking at these abnormal LDLs and these small particle and these large particle number. So like I said, you can have a normal lipid panel and have abnormal size. They're too small, and you have a lot of them. The particle sizes are great in number. Let's talk about the oxidation. What does that mean? Well, when these bad cholesterols get inside the artery, they become oxidized by what are called reactogen oxygen species. So these reactive oxygen species are compounds that are made because you breathe, you're human, and these oxidize these bad cholesterols. That's just one of the things that goes on in the body, one of the chemical reactions. We create these little compounds that oxidize these bad fats, especially when they're in the smaller category. They get stickier, and when they become oxidized, this increases inflammation, brings immune cells to the artery, and this is what causes the plaque. It's actually the oxidation of these cholesterols, the LDL. When you have the smaller ones, you're going to be more prone. They're stickier. You're going to get more plaque than if you just had bigger, fluffier ones. So what that means is that this small, dense LDL also stays in the blood longer. It increases the fats in the blood, which is also associated with insulin resistance. So you increase your fatty acids. This is what is increasing type 2 diabetes. It causes what's called lipid toxicity. Well, also is the LDLs, especially the small, dense ones. This also increases this lipid, which means fat toxicity. It shows up in your muscles, and it also shows up in your arteries. In this case, these are going to be predominantly in the artery. So what we're talking about when we talk about insulin resistance and how fat can affect that is every time you eat a carbohydrate, it breaks down to glucose. You guys know the story. The glucose goes to the muscle cell, insulin's released, and the whole idea is that insulin's goal, this hormone's goal, is to attach to a receptor site, which then allows a transporter to the surface and allows the sugar to come inside the muscle cell. What happens is this receptor site can become corrupt. It can actually increase in fatty acids that cause a disabling of this process, and the receptor site never comes to the surface, so the sugar never goes to the muscle cell. excess fatty acids are what contribute to type 2 and type 3 diabetes, which is what goes on in the brain with insulin resistance. So I have some videos that are really great at explaining this. I do a YouTube just on insulin resistance, type 2 diabetes, type 3 diabetes, which is insulin resistance in the brain. So you can go to sugar does not cause diabetes, you were told wrong, and this video will really go into detail. But I'm always having to go back to it because for some people, they're hearing it for the first time. Maybe this is the first video. Lipid fat toxicity is really a culprit for a lot of issues. And I know it's out there, the ketogenic diet, everybody's loading up on fats. Fat is good for you. Fat helps line all your membranes. Good fats are good for you. But the key is too much of a good thing can be a bad thing. And so that's really what I'm trying to bring home when I'm discussing how do we eat. It's all about understanding the macronutrients, protein, fiber, and fats, and how we balance them. So a lot of these fatty acids, excess fats, eating too many fats can actually cause a problem where it can increase type 2 diabetes and type 3 Alzheimer's. It can also cause a problem in the arteries. A lot of these LDLs, especially if you have the smaller ones, this means you're going to be more prone for plaque. That means we want to lower overall cholesterol, the bad ones overall. So if you have the small ones, then it's really super important to understand what type of diet, what kind of lifestyle we need to reduce the lipid toxicity, excess fats. Ideally, what the diet is that's going to do this. And I just want to also emphasize the difference. Let me see if I find the video, that you can have elevated LDL particles because you have particle number and you also have the particle size. So when you're looking at getting your test, you're going to have it where you're going to be looking at the LDL particles. So you'll have a test that will be LDL particles, and it's going to tell you the number of particles in that LDL concentrate. So when you look at the cholesterol that you're getting from your doctor, let's go back here, and we see the LDL-C, which is typically what you're going to get. Well, within that, you're going to get a particle number, so you can get a test for the particle number, and also the particle size. So you got the LDL particle numbers, and then you have what is going to be the small, dense LDL. This is the size. So the smaller ones are more prone for plaque, they're stickier, and also if you have a larger number, even if you have a larger number, and it doesn't matter if you have the bigger ones or the smaller ones, having a larger number of particles can also not be a good thing. Now, if you have a larger number of particles and you happen to have the small, dense ones, that's a double whammy of risk. But I really want to emphasize that these two lab markers are not typically done, but they really give a lot of insight on that LDL-C that is typically done. So these two can really increase your risk for heart attacks and plaque. So we want to, on the LDL-P, on the particles, we look for an ideal particle number. We like to have you less than 1,000. Once again, when you're asking your doctor to do these two tests for you, they will have the range for you there. So you don't have to remember it. It's going to be on that lipid panel. So what I wanted to bring to light for you in this video is understanding that sometimes the cholesterol panel that you get from your doctor may not be enough. You can have a normal lipid concentration, but you need to know the particle number, and you need to know if you have the small ones or the big fluffy ones. You're going to be at risk with the smaller ones. And then what's the type of diet that's going to reverse this? Well, the epigenetics, what causes it to be worse is having a diet that increases this lipid toxicity in your blood, which means eating a lot of processed foods, low fiber foods, eating a diet that isn't bringing in the healthy fibers. So we want to decrease a lot of this lipid toxicity, taking in a lot of these seed oils. This increases the lipids. These are not really good for you. Increasing your fiber is going to help. lowering some of the fats. And I'm not really talking about a low-fat diet. A lot of people say, oh, she's advocating a low-fat diet. I'm advocating the right amount of fat in your diet, okay? There's a huge difference there. But what we see right now in the typical Western diet is a lot of fat in our food. A lot, you go to the restaurant, they're putting it in everything. They're just loading up on these oils. That's a big problem. The body wants to have these macronutrients at the right percentages. Also, antioxidants can help. When we talk about these free radicals, when we talk about these reoxygen species that oxidize, so when we go back to this slide and we talk about these LDLs being oxidized by these reactive oxygen species, which are compounds that are naturally found in our body, these are oxidizers. If you can take in antioxidants, they actually neutralize these. And if you can neutralize these oxidation compounds, then there'll be less chance they'll be able to actually damage the LDL and cause the inflammation and contribute to the plaque. So we want to think about antioxidants. Antioxidants are typically going to be found in vitamin C, that's an antioxidant, vitamin E, anywhere from 50 to 100 milligrams, high color vegetables. Those have your carotenoids. Those are your greens, your yellows, your reds. These vegetables have antioxidants in them. These antioxidants, they literally can stop this oxidation process from happening in your arteries. So eating a diet of a lot of plants with these colorful colors will really help lower these LDL oxidations from happening, right? Because they neutralize some of these reactive oxygen species. Also, balancing your fats with the omega-3s. Niacin can also help. We talked about niacin when we looked at the lipo-a gene marker, which is another bad cholesterol. Well, it can also help with this. But bottom line, niacin in this case isn't really necessary if you're really following the diet that can reverse it. If you do the niacin, you want to make sure to get the nicotinic acid. Okay, there's different forms of niacin. This is the one that helps lower the LDL lipo-a cholesterols. So when we're looking at the right kind of diet, it's understanding how do we get the macronutrients right? How many fat grams do we need? And I do bring in the proteins and the carbs and the fibers because it's important. That's all part of your diet, getting the macronutrients right. So I'm not about paleo diet or do we do a vegan diet. It's understanding that the macronutrients, the protein, fiber, fats, and the really how all this works in balancing your diet is really the key. So let's just focus on the fats. How do we know what the correct value of proteins, carbs, and fats should be? Well, if you look at a percentage, you can't do a doggone thing with it. You can't sit at your meal and go, oh, I think I'm getting 20% of protein. You got to look at the grams because all labels will have grams on there. And that gives you a better indication when you understand how many grams of each you need. So how do we get to that? Well, first you got to figure out your ideal body weight. Because when you look at your macronutrients, except for protein, it's based on what your ideal body weight calorically is. That's how you decide the percentages, not the weight you weigh now. So for a woman, the way we do that is that we take, for every inch over 5 feet, we will add 5 pounds. So we start with 100 pounds. So if somebody is 5'4", then that means that, hold on again, let me get my pen.
Get the pen at the outside.
Okay. Techie stuff. So if I have, if my height is 5'4", and I,
The pen option selected on the side.
okay, let me get that, got it. Okay, so if my height is 5'4", and that's 4 inches, I subtract 5 feet, so 4 times 5. So for every inch over 60 inches, which is 5 feet, I multiply by 5, that's 20, so it's going to be 120. and I've done this in other videos, that's your ideal body weight. You can easily add 10 pounds to that. That's a range. It'll still be with a BMI. And for the male, it would be the same thing. Okay.
You gotta center it.
Okay, there we go.
No.
Not good on the techie stuff here. Okay, there we go. Got it. Whew. All right. Here we go. Thanks, Sam. So for every inch over 5 feet, you'll add 6 pounds, and it's 106. So if somebody is 5'10", that's 10 inches. 10 times 6 is 60, so it's going to be 166 pounds plus 10 pounds. So when you're looking at figuring out what your macronutrients are, you use these values to come up with what your fats are. So if your ideal body weight is 120 pounds and you would divide that by 3, that's going to give you the lower end. You can easily add 20 grams to that to get it up to 35% fats. So anywhere from 25 to 35% fats is not going to be a lipid toxicity effect. So fats at 35% is where we should be, not fats at 50% or 60%. So if we take this and we do the math on it real easily, what we come up with is 120. We divide that by 3, and that's going to give us an estimation of 40. We can add 20. So anywhere from 40 to 60 grams is going to be anywhere from 25 to 35. This would be a realistic number of fats that you need. So if you're doing fats and you're up at 100 grams or 150 grams, this is more than the macronutrients needed for your body. And this can be a problem and can increase some of these LDL fats and also type 2 diabetes. So it's a lot of information. What I wanted to bring home in this particular video was that these lipids aren't always enough information. Getting a little more information to know the particle number and the particle size gives you more insight to understand what kind of risk you really are at. And you can have a normal lipid panel and have elevated particle number and smaller particle size. Normal lipid panel and be at risk. In fact, I know for a lot of my patients, Sam, is there? Oh, there we go. Bring it down. I know that for a lot of my patients, they come and see me. They're bringing me their lipid panel. Everything looks great. And then we get more information and we find out they're at an increased risk than they originally thought because they're seeing more information about their cholesterol. So I wanted to also, guys, if you want to get more information, you can always go to my website, myrnamethod.com. I have more information there. I have a membership. I'd love to see you there. That way, I help you with your diet. That's what I do on a Tuesday live stream, and we really get into the nitty-gritty on what you need to eat to maintain your leanest and healthiest weight. So I wanted to leave it open for any questions. And Sam, if you want to go to the live chat.
Let's see. No, we do not have
Any
questions
all right.
tonight, but
Awesome.
don't forget to like and
Oh yeah, don't forget to like and subscribe. We got to get up right on this techie stuff, right?
I mean, they
Yeah.
can also, if they have questions later, they can put them in the comments.
Okay, there you go. Put them in the comments and we'll check them out and get to it. Okay, Sam, is there anything else?
No, short and sweet.
Okay, awesome. See you guys next week. Thanks for joining.